The information provided on this podcast is for general informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your qualified healthcare provider with any questions you may have. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast. Reliance on any information provided here is solely at your own risk. Welcome to the Birth Baby Podcast. Each week, you'll find guidance, encouragement, and practical tools to support you through pregnancy, birth, and the postpartum journey. I'm your host, Ciarra Morgan, a certified birth and postpartum doula, hypnobirthing educator, and pediatric sleep consultant. I'm also the owner of a doula agency in Austin, Texas, and the founder of the Birth Baby Academy, where I offer classes for both parents and birth professionals. Thanks for being here. Hello, everyone. Today I have Mary Farrelly with me. She is a NICU nurse, educator, and doula trainer with over a decade of experience supporting babies and families through some of the most complex beginnings because, y'all, she helps people understand how to deal with the NICU. She has a company called the NICU Translator and the NICU Doula Academy, and her program is just incredible. I am so excited for you to be here today with me and help people understand a little bit about the NICU. So thank you for being here.
Thank you. I'm so excited.
This is such an experience for people and a lot of people don't know that this is going to be an experience that they deal with. Some people do, and not that that's great, but it's kind of nice that they can help, prepare themselves. So first off, can you just explain even what the NICU is to people listening who are like, what are they talking about? I also hear people say NICU or I've heard so many different pronunciations. So people listening, that's what we're talking about. Can you explain what that is and how somebody might even find themselves being a NICU parent?
Sure. So the NICU stands for Neonatal Intensive Care Unit, and it's a special part of the healthcare system that delivers specialized care to infants that need additional support or monitoring immediately after birth and until they're ready to be discharged and reunited and kind of finish on their normal baby trajectories. So it is a really kind of unique world, even as a healthcare professional. It has its own language and its own kind of culture and flow. But it is just like one of those special places where we get to witness real miracles unfold in front of our eyes. It's truly a special place, and nowhere else I would rather work as a nurse. But that being said, it is a more common experience than people think. So the NICU is something that is often left out of prenatal conversations or birth planning classes. There's a lot of reasons behind that. And I'm kind of on a mission to kind of shift that and bring more NICU awareness, especially in the prenatal space. I'm so excited just to have this conversation because it's 1 in 10 babies in the United States have a NICU stay as part of their journey. So, if you're teaching, you're in a birth prep class and there's 20 couples, statistically 2 babies will need the additional support of the NICU team. And as you mentioned, a good amount of the families do not expect the NICU to be there. It's something that happens rather quickly. And it can go from, pregnancy is going great and all of a sudden my water breaks and I'm in preterm labor, or the baby's born and everything went smoothly, but now they're having a little bit of a harder time breathing or they're needing additional support. And there's a lot of different reasons that a baby might need that additional monitoring. But one reason and one way that I want to frame it is that, when you think about being pregnant and the baby's basically on cruise control, like everything's being done for them through the placenta. They have a heart and it's beating, but it's not maintaining blood pressure. They have lungs and they're kind of doing these practice breaths, but they're not exchanging gas or responsible for maintaining oxygen levels. They have a GI system and it's making meconium and kind of practicing a little bit, but it's not actually digesting and creating nutrition. So when babies are born and they're, cut off from the placenta, it's kind of a miracle that 9 out of 10 times everything goes perfectly according to plan. All of a sudden, all these systems just turn on and they are functioning.
Band-Aid ripped off.
Band-Aid ripped off.
You got to do it on your own.
Some babies just simply need additional support during that transitional period. So that is the main idea behind why a baby might need the NICU is because one or more of their body systems is requiring additional support. That's kind of the overall vision for it. But in terms of more common reasons why a baby might need a NICU stay, another myth that I hear around the NICU or a common myth is that the NICU is just for preemies, right? It's just for babies that are born prematurely before 37 weeks. And that there is truth to that. Depending on where you are, about 50 to 60% of NICU admissions are for prematurity, but that's roughly half-ish that are for term infants that need this additional support. So one of the most common reasons is respiratory distress, so having a harder time breathing, turning on their lungs. Another common reason is for infection, whether it was something that was transferred through the placenta or something that happened during birth, because babies are born with very minimal innate immune system capacity, and then preemies are born with even less of that just by the time of gestation when they're born. And then there's other reasons like having low blood sugar, having jaundice issues. And then we have our friends that those are the few that might know prenatally. And those are typically babies that maybe have some type of a congenital difference that may have been caught on ultrasound. So babies that maybe have a congenital heart disease, something going on structurally. Maybe they know about an infection or some type of growth restriction or something that's going on that has been monitored throughout pregnancy. Those are the few families that might know that the NICU is part of their story. But for the most families, it is very surprising. And so because of that, it can feel really overwhelming and shocking. So I'm kind of on this mission to offer just enough insight and confidence so that parents can step into the NICU with the same level of understanding and feeling of empowerment that they would in the birth space or in the postpartum space. And a quote, typical experience, have that same kind of feeling of, to a certain extent, confidence and ability to feel like a parent, no matter where you are as part of your birth journey.
Yeah. And I think that a lot of people have this kind of misunderstanding or thought that if someone goes to NICU, it's like this big, long stay. Like they have in their brain, like a NICU stay means they're there for weeks. It's like an automatic, don't pass go, don't collect $200. We're going to be here a while. Where some babies can be in the NICU for even a day, right? Like it doesn't always have to be a long stay.
No, not at all. So the average length of stay, which is like, when you go back to math, like average is like all the extremes put together. The average length of stay is 14 to 21 days. But that being said, most babies that are a term are in the NICU for a short period of time. The shortest stay in most NICUs is about 4 hours, and that's typically for monitoring, support, stabilization. And then the goal is always to reunite the baby, the couplet, or to be at the point when they can be safely discharged to home, whatever that might look like for that baby. So there's a lot of different factors going on. That it can be as long as 4 hours, but there are a lot of longer stay NICU experiences as well. Like I've celebrated first birthdays in the NICU before. So the range is incredibly wide. But that is definitely a common myth, like we're in the NICU and this is just our life now. But sometimes it is simply stabilization and support to get over whatever body system that needed that support to get it kind of caught back up. And then off we go on your merry way.
Yeah, I try to tell parents ahead of time because I do teach hypnobirthing classes. So I have contact with a lot of people where I'm not even their birth doula and I get to talk with them prenatally, which is nice. And I don't talk a whole lot about the NICU, which maybe I should be changing that. And there you go. You're teaching me something too. But part of it is we don't want to scare people and be like, oh, this could be part of your journey. I think that's part of the reason that people don't talk about it prenatally as much. But I do let people know that in a hospital setting, at least here in Austin, Texas, if someone has meconium pass before the baby is born, then that is something that automatically in our hospitals here, somebody from the NICU is in there when we're pushing and right before the baby is born, because it's just a just in case. So I let people know that so that they don't worry when they see a NICU nurse come in. They're like, oh gosh, is something wrong? Is my baby going to be taken? No, not automatically. It's just kind of a safety net. They do that to make sure if something happened and we needed extra support, they're here right now. And it's kind of funny because at a birthing center or a home birth, that doesn't necessarily automatically mean that we need to transfer to the hospital either, though. So it's just that extra level of caution of just in case. And so I think that it's really important for parents to see that there's that really wide range and that, yes, you might know way ahead of time. I just had a 26-weeker with a family where from 24 weeks we were in the hospital or they were in the hospital, and we knew from about 20 weeks that this baby was going to be coming early. And then some people find out around 37 weeks because their waters release early. And then some people find out when their baby is being born that they're going to need it. So there's such a wide range of when people can find out. And so then they get to, at least if you find out ahead of time, a lot of times the NICU will come in and have kind of a conversation with people, right? Like do a little on the job training real quick, help them figure it out?
Yeah. So if the family's either admitted antepartum, is super high risk, maybe they are having multiples, or there's something going on where we know we're gonna deliver early, or that the baby is going to require intervention or surgery or whatever it is right after birth. The goal for most NICUs, especially if time allows, which it doesn't always, sometimes we're admitted and we're like, okay, we got a couple hours to sit here, and then we have to move forward. The baby's coming. Usually a neonatologist or nurse practitioner will come to the bedside and do like a little crash course. If there's extra time, many NICUs try to do a NICU tour if possible, where the family can come for a short period of time, usually 10 to 20 minutes at a time, and kind of just see the physical space, maybe see what type of bed the baby would be in, whether it's an isolette or one of the radiant warmers with overhead heaters. What is a general gist of visitation policies? What are some smells and sights you might see? But they're usually pretty brief. And in my experience, especially since I started to do more work as a NICU doula and like kind of helping to fill in these gaps, oftentimes they're really based on like medical outcomes and statistics. It's less about like, how are we going to navigate this as a family? It's more about like, here's the diagnoses, here's the treatment plan, and like, here's some stats around outcomes, especially with
very sterile.
It's very sterile.
Medical, and, not and emotional, and having you figure it out.
No, because that's just the people giving that conversation. That's not their role typically in the NICU. They're really focused on excellent clinical outcomes for babies that require additional care and support. And that's what the NICU does incredibly well. Like even being a nurse at bedside for more than 10 years, like what we were capable of doing as a brand new nurse at the bedside, there were babies that we literally could not offer resuscitation to because we didn't have the equipment and the technology and the protocols to allow them to survive. And now it's drastically changed. The edge of viability is changing. The types of procedures that we do, non-invasive procedures, pre-pregnant, like in utero type procedures. It's just incredible how much that has changed. But what is still kind of lacking sometimes is that true family-centered, holistic approach to integrating postpartum into this very medical setting that is the NICU, because it is an intensive care unit. By definition, it is somewhere that medical care is being needed to be given, which is a little different than the birth space, where assuming there's not a lot of complications and there's not a lot of need for intervention, it is a different environment and different priorities, and the ability for an adult to advocate for themselves is now shifted when there's now two people. There's a baby and a parent. And so there's this other dynamic that sometimes plays out too. But I do also, kind of going back to your idea of including the NICU as part of prenatal conversasations and not wanting to scare people. That is very, very common, that people don't want to, I guess, fearmonger or create fear where there doesn't need to be. My counter argument to that, when I see families as the bedside nurse coming to the NICU, no one ever told them this was a possibility. There's literally, they have no concept of what is the NICU, what is the capacity, what does this mean? They're thinking about it no matter what. The fear is there. They're just not talking about it. And by having even a light conversation and almost destigmatizing it to a certain extent, I feel like it allows families to feel less fear, like when they see it happening. Like even having that NICU nurse come to the bedside, like, oh, well, we talked about this already. Like some babies have the NICU team standing at the bedside, and that's like kind of protocol for a lot of, and it's that extra layer of support. And hopefully my favorite deliveries would be like, the baby comes out screaming and I'm like, peace, see ya. Like, you 2 thumbs up, baby, like we're doing it. But otherwise we're there if the baby needs just that transitional support even too. So I like to have these conversations because I'm also a birth doula too. Like I have these conversations from a place of fear, not fear, of empowerment. So I use
education is what releases fear.
Yes. Yeah. Exactly. I use this fire drill model.
Hypnobirthing is all about, you know.
Yes, exactly. I like to say to my birth clients, like, my daughter is a first grader. They have fire drills at school. They practice what would happen if there's a fire. It doesn't mean that they're manifesting a fire. It doesn't mean that she's going to go home and only think about fires for the next like weeks and weeks in time. It just means that if a fire does happen, they have a loose plan in place so everyone feels more confident and safe. Like that is where high risk and more those harder prenatal conversations, I feel like, treating them more like this fire drill, like we're practicing at one time, we're talking about it at one time, we're packaging up in a bow. If this were to happen, here's my wishes and my desires for how this looks for my family and my baby. And then if we need to open the box, we do. And if not, it's just there. So that
it's just like a C-section part of the birth plan.
Exactly. Yes. Just like you would plan for those contingencies.
Yeah. I also want to mention too that some people like listening to this, if you're planning a birth at a hospital, just because you're planning a birth at a hospital doesn't necessarily mean that they have a NICU or that they have a NICU that has a high enough level to be able to help your baby if it is at a certain point. So there is the hospital actually that's closest to my home doesn't have a NICU. They have enough nurses that they can kind of be a bridge. But actually, if you go into labor before a certain week gestation, they have you not even go there. They have you go somewhere else. And there are other ones in town that have a lower level NICU, but they may have to transfer to another hospital, either prenatally or postpartum after the baby is born, to go, oh, shoot, this baby actually needs a higher level of care than we're able to provide. So just wanted to bring that up so that parents aren't surprised if they ever have to be transferred as well.
Yep. I have a free template that I just like literally want everybody to go. It's like birth planning plus. Like you have your birth plan template. This is your plus. So this is the fire drill, like what we go through. And one of the first questions on it is, what is the level of care of the hospital, of the NICU at the hospital or area that you're providing? If it's a lower level of acuity, do you have a preference of where you would want to be transferred to? Because you do sometimes have a say in it. Or people would say, I didn't know these levels of care were a thing. If I had only known, I would have chosen XYZ different path. I would have, if you wake up in the middle of the night and you're in labor at 26 weeks, I would have gone here versus here. So even that alone, having that knowledge can feel like, okay, I at least have that kind of idea in my head. So that piece of it can feel good. But that's the first question on the birth plan is it a level 1, 2, 3, or 4 NICU? And if not, what is the transfer pattern? And what are my preferences around NICUs? Because they're all different.
And there are some hospitals here that auto-transfer to Dell Children's, and there are some that would auto-transfer to Texas Children's. And so I know in my head, I'm not going to say on here and be rude, but like I know which one I would want to go to postpartum if my baby was born and needed additional help. I for sure wouldn't want to go to one of them. So knowing that ahead of time would be really helpful. So talking about the postpartum part of this, because yes, we know that NICU in and of itself means your baby is going somewhere. We don't know how long for a period of time. But what are some things postpartum that come up for families that maybe they didn't think about ahead of time that might be different for a NICU parent than for a typical postpartum?
Yeah, so the biggest thing to know about the NICU, and one of the hardest pieces of it is, as you're explaining, is that there's always some element of separation because the care that you're receiving as the person who gave birth, who's postpartum, is typically in a different physical location than the care that your baby is needing to have in that moment. And there's some shifts around that. There's like some more NICUs that are trying to do like dyad rooms, and there's movement towards that. But the reality is they're going to be in 2 separate spaces. So one of the places that this, even if you have a short stay in the NICU, is super important is around your feeding preferences. So if your goal is to produce and provide breast milk for your baby, one of the things that kind of is paused in a NICU admission is typically, depending on what's going on, whether it's breathing or infection or things, we deprioritize, or the baby may not even have the capacity for oral feeds at that time. So being able to latch and take milk directly from breast. So in order to then create and tell your body, okay, it's time to start making milk and use those super, super essential first hours and days post delivery to create those pathways that your body's going to rely on to establish a milk supply and maintain a milk supply long term. It's going to look like pumping, and it's going to look like very intentional pumping practices, even if it's a 4-hour delay and your baby is going to be able to latch within 4 hours. So as a doula or someone supporting a family or someone who's maybe high risk and planning for or expecting some type of a NICU stay is having very clear plan about what pumping is going to look like for you. And ideally, the gold standard is to have pumping set up, whether it's hand expression or on a hospital grade pump, within the first hour after delivery. And that's not always possible, especially with a NICU delivery. You're like, okay, I want to go see my baby, and okay, like I'm dealing with my physical needs, or maybe I had an emergency C-section or something happened that is now going on physically. So there's some, you have to prioritize what's what's best for you in that moment as the person who has the body that's going to be producing milk. But it is super important and is often missed too, especially with transfers. So the NICU that I've worked at for 10 plus years is a level 4. So meaning that's the highest level of acuity. So we get people from all over. And the amount of times I've had family come and it's like day two or 3. And they're like, I was like, okay, what are your goals for feeding? And they'll say, I would love to breastfeed. And I'm like, have you started pumping? And their answer is like, no one ever showed me a pump.
No.
So at that point we can try to catch up, but it's much harder to backtrack and to try to get that like milk supply when the hormones are ready to go established too. So there's sometimes a sense of like grief and loss around not getting to have those early breastfeeding experiences. And so when you're supporting, especially if you're a doula or a loved one listening to this, knowing that when you're helping to support a family through a NICU stay, there's a lot of really intense emotions around it and that are incredibly valid. And some of it is around the fear of the unknown and the separation from your baby. But another part is around this loss of what you thought your initial golden hour or your postpartum experience would look like, maybe was written in your birth plan. You're not seeing any of it right now. So there is going to be like some logistical things that you may not have thought about. But one of the things that you can tangibly do, because oftentimes NICU families are like, okay, the NICU team is physically caring for my baby right now because of their unique medical needs. What is something that I can do? And so sometimes it is bumping and it is expressing milk too. And even if it's tiny, tiny drops and you have a tiny, tiny preemie, we do oral care. We treat that milk like precious gold in medicine. Like breast milk is the gold standard for what to feed preterm infants. Even if a family cannot or is not able to produce breast milk, then we go to donor milk and establish feeding practices with that. But a lot of times families are really shocked that even if the baby's on respiratory support, they're likely not going to be able to latch. They can still skin to skin, but their body cannot multitask safely and eat either effectively or safely, at least for sometimes a couple hours, sometimes a couple days. If they're premature, it might be a couple weeks before their brain and their body system are mature enough to be able to even try to latch too. So that's one key thing to kind of help, again, a piece that I guess you can control after a NICU stay or prepare for it too. So this might look like what maybe doing like a prenatal breastfeeding visit where you are with an IBCLC and you're looking at what phalange size might work and you're learning how to use a pump, talk about what hand expression looks like, because that is a huge, especially for preemie colostrum. Preemie colostrum is different than term colostrum. It has a different consistency and different nutritional components, which is super cool.
So cool.
The body
our bodies
knows,
are amazing.
but it's really thick. So sometimes it's like you really need to be able to do some hand massage and expression to get those precious preemie colostrum drops too.
Yeah, I'm so glad you said something about like it could be literal drops and that's okay. Like don't quit because you only see a couple of drops or you don't see anything.
Yes.
Because that doesn't mean it's not going to happen. It's a supply and demand. And if you're not demanding it, the body doesn't know that it needs to supply it. So it doesn't even have a chance. That 26-weeker that I recently had, she was 1 pound, 2 ounces. And because she was under the first percentile, that's part of why she needed to be born. And her mom was like, I will be darned if I don't breastfeed. Like, this is something I am going to do. Like, I'm having this baby. We were planning a home birth too.
Right.
So not only were we having a baby early, like we're not even having a baby where she thinks, and now we're having a C-section. Like everything had gone off the rails. But darn it, this was one thing that she could try. And she was in shock when we first started. She didn't want to do it and she didn't know how. I was like, are you okay with me doing it? And she was like, yeah. So I was like, okay, here we go. You're going to feel a little bit like a cow. And like, we kind of made it silly, and I'm sitting there milking her and I'm squeezing and I was like, look. And there was that tiny little bubble that just forms on the tip of her nipple. And the look on her face, because you're 26 weeks, you don't think your body's going to produce anything, you know? And then we popped a pump on her because she wanted to see what it did. And before I left, she kind of wanted to get in because nobody was bringing that to her. And it's a great hospital, but it's like the moment the baby isn't in that room, people like the care providers a lot of times forget that we still need to pay attention to that piece.
Yes, 100%.
It's just out of sight, out of mind. There's not a baby there, so we're not thinking about latching it. And so we got the pump in there and we got going. I could not believe how much colostrum she got on her first pump. And I mean, her husband was like jumping, so excited for her, you know? So it's like little wins, and not everyone's going to have that experience, but just giving yourself the opportunity to try. Like putting that on your to-do list. And this is a great example of why someone might want, like, I'm just a regular old birth doula, you know, like I don't have specific NICU training. This is absolutely my earliest baby that I had ever helped with. And there were things that I had to teach myself before going in, like, okay, this baby probably isn't going to cry when she's born. She may not have her eyes open when she's born. I actually am the one that sent them a picture of, I talked to them on the phone first. Hey, are you okay with me sending you a photo of what your baby may look like when she comes out so that you know ahead of time the state that she may be in? And they were like, okay, thank you for telling us first. Yes, please send it. And then they did. And they're like, this was so helpful because this is not what we were picturing. And now we can wrap our mind around this. And the only reason I knew to do that is because I have a girl on my team who took your NICU doula course. And she was the one who was training me behind the scenes on how to help. And then I got to refer her to these clients because I was like, hey, I'm just a regular old doula and I'm pretty good at what I do. Yes, I have a lot of experience, but this is a little out of my wheelhouse. And there are other things that it's like, I don't even know what I don't know.
Right.
And if I hand you over, this person is going to be able to help you through this experience. So can you tell a little bit about what is a NICU doula and why someone's regular birth doula or even postpartum doula might not be able to help them as effectively through this experience?
Yeah. So the concept of a NICU doula is, I did not.
You made it up, right?
I didn't totally. There were people existing in the NICU doula space, but what I really want to do is bring it more mainstream. So like it took a little time for the concept of what a birth doula is to hit.
Yes.
General.
Even 7 years ago when I started, it was way not as much known as it is now.
Yes. And I think that what happens similarly to the idea that after someone gives birth, the medical team, if the baby isn't in the room, kind of is like, ooh, you don't really know what to do with you. Like,
it's true.
Back away. It's the same thing I feel like happens sometimes in the birth and postpartum doula space, is that because the NICU is not part of most doula trainings, even though I feel like there's a lot of room for that because as you shared, like it's 1 in 10 babies. So likely sometime in people's career, the NICU is going to be part of their client's story. It shifts. As I mentioned before, there's like a different language around NICU stays and culture that a family's being crash course initiated into. It's a sisterhood they didn't want to belong to or they didn't know existed. And so having someone that can help walk alongside you, who can help translate the NICU experience, who can help shift you from this feeling of maybe powerlessness or lack of autonomy or overwhelm into this like kind of advocacy role, because that is something that a parent really has to step into very quickly as someone who's in the NICU setting, even if it is a short stay, and understanding the nuances of the baby's lived experience in the NICU too, because there's two people, or really two entities going through the NICU experience. There's the family who has the different emotional, lots of very unique practical needs that are different in a NICU setting around visitation and infection and how to manage coming back and forth, how to manage siblings that are also in the NICU, so how to manage multiples that are in different even sections of the NICU. And then there's the baby's lived experience too, because they are people, they're little humans that are starting their life in this very unique environment. We do a lot in the NICU to try to make it as neuroprotective and healing as possible, but there's gaps there too. So being able as a birth doula to be able to help a family both navigate those early golden hour experiences and then walk alongside a family throughout their NICU stay. And then also continue as the trajectory goes on, because one of the other things that happens to NICU families, especially those that are in the NICU for even a couple days or longer, you become really intertwined with the culture of the NICU. So that your baby's on 24/7 continuous monitoring. There's alarms telling you what's going on. If you have a question about, what's going on with your baby's feet, or are they breathing okay? Or what does their poop look like? There's a lot of anxiety that builds up in a NICU stay, which is appropriate too, because you're seeing the baby actually struggle. So like, unlike a maybe you're a regular, quote, regular postpartum doula. You have a client at home who's worried about their baby stopping breathing. And how you might talk to a family that has a well baby who's like, this is, they're safe on their, wherever the position is, like how they're breathing. For a NICU family, it's going to be very different. They maybe literally saw their baby not breathe and stop breathing and change of color, or they may be at a higher risk for having a infection like RSV or the flu after NICU. So it's a different level of being trauma-informed care and understanding the lived experience and the culture so that a family doesn't feel so isolated and also feels like they have someone who's just there for them and not just there for their baby, but they're there. The role of a NICU doula is to support the NICU family so the NICU family can then show up for their baby in their best, most whole version of themselves so that everyone can thrive and not just survive. Because right now, most NICU stays, everyone's just surviving through it. Like our survival rates are great, but families are coming out at the other end with
traumatized,
really intense rates of PMADs and clinical PTSD and all these other long-term symptoms that don't end at discharge. Like that's the other really common myth or like almost pressure that we put on NICU families is like, you're out now. Stays, you're out now. You can just move on. Your baby's fine now. They're just normal. Why are you so worried? Why are you so rigid on your care times? Not respecting or understanding the very real institution that they're being raised in, that is the NICU, with its very strict and specific protocols and rules and policies that are where families are entering the sacred space of matrescence and stepping into this role of a parent. Whether you're a first-time parent or it's your sixth baby, it's going to just be a different environment. So having a NICU doula who can help, who is trained in this unique care environment, can help decrease the bad outcomes for families like PMADs and PTSD and increase those positive outcomes like breastfeeding rates of discharge and bonding and attachment and all the other things that we know are good for NICU babies and families, but are sometimes harder to execute as someone who is a clinician in the NICU at the bedside. So it's really bridging the gap, both for the medical care team and a holistic model of care, and then also bridging the gap between the NICU and home, because there's this huge shift from continuous monitoring and 24/7 nursing care to like, here's your baby, good luck.
Yeah.
You got this. And the more I worked with families as a NICU doula, I specialize in the transition to home. Seeing how my discharge teaching as a NICU nurse was kind of setting up families unintentionally. I thought I was doing a great job, unintentionally setting up families for not necessarily failing, but feeling real gaps in their confidence and their capacity for stepping into that new chapter. So I would love I have two training options that are helpful. One is the shorter course that I feel like called the missing chapter of every doula education, where any birth or postpartum doula can at least have this extra layer of understanding and knowledge so that we can feel confident in supporting our families too. And then there's the full deeper layer of becoming a certified NICU doula or CND and really stepping into that role as a professional capacity. So
what are the names of those two?
Yeah, so the shorter course is Navigating the NICU for Doulas. That's self-paced, and it's about 5-ish hours of content plus some like cheat sheets and videos that you're like, okay, I need this now. Like my client's is in labor at 31 weeks. Like, what do I do? And so that is Navigating the NICU for Doulas. And then the more intensive certification program kind of came out of that because I was finding people were wanting to work with families in a deeper way or really specialize in working in NICU families. So that's NICU Doula Academy, which is the 10-week live cohort certification program that trains on the full spectrum of NICU care and support. So we go from antepartum planning through supporting families at the bedside, transitioning to home, putting into practice, partnering with hospitals, really bringing that role as a professionally trained and certified NICU doula into the culture of NICU care too. So I really wanted to create something that is accessible for everyone, because what NICU families need doulas more, I say more than any family does. But because of how both NICU culture is set up, is like very bubble, like you can't come in unless you're invited in this space, which there's some reasons behind that. There's a level of protection and infection control, but we're really not letting people in who can help these families. And so the burden of postpartum support is falling on a NICU nurse. I, as a NICU nurse, was not trained even a drop of how to support a postpartum family. My patient is the baby. And so inadvertently, we have these families who are spending the bulk of their hours with me and with someone who it doesn't have the capacity, the time, or the training to really support them as they deserve and need to be supported. So trying to really bridge that gap so then everybody wins. Like as a healthcare professional, I know that my families are being cared for and supported. So then I can really devote all my energy and time into the clinical excellent care of these babies and still support them as a family. But like the simplest things don't happen or aren't even thought of. Like when I started NICU nursing and I wasn't a mother myself, I was a very happy-go-lucky brand new nurse. And I thought everything was great. Yeah, all the energy, all the intention. And I did a good job, but it wasn't until I was a parent and I was like, guys, like we don't even have like pericare in this unit at all. Like I was having to call labor and delivery and be like, can you tube down a pad? And I was like, this is so ridiculous. Every single person in this unit is still bleeding. Like everybody is still bleeding. And we just it didn't even register. So like, it's the simplest things of that, that are missing, or even like access to water. Where's the bathroom? It's like way down the hall.
Right.
Like what does the chair look like for someone who maybe had a C-section or has a massive tear because of something going on? Like how are we actually accommodating, supporting these families? It's kind of Instagram versus reality. We like the saying we're family-centered care, but then in practice, it's still missing a lot of pieces. So the NICU doula, my vision for that is really that's the person that can plug into this model, whether they're being supported and cared for in like one family as an individual, as a one-on-one client, or having someone that is integrating into either a peer support model or a nonprofit or at the bedside and hired directly through a hospital too. And then helping with that transition to home. So that's another key piece, that having that extra layer of knowledge and understanding can help families feel seen and supported. And so they're not constantly having to explain themselves or be like doubting them. My discharge instructions said to feed the baby this way. This is what we did in the NICU. Now my postpartum doula is saying, I don't need to worry about that anymore. Just do X, Y, Z, which is probably coming from a place of great intention, but ultimately is creating this like, whoa, who do I trust? I don't know how to trust myself as a parent. So much autonomy is stripped of families in the NICU just by the design, right? Like this is the one place in your life you have to ask permission to touch your own baby. It's just not normal. And then you go home and you're back in the driver's seat, but having all this like doubt. So the NICU doula is also there to help coach families back into their power, back into their role as the person who knows their baby best and can independently and competently care for their full spectrum of needs too. So many ways. And clearly it lights me up.
It does. I love it. I love your passion. One of my questions was going to be like, how could a family determine even if they had a birth doula or postpartum doula or didn't, whatever, how could they determine if a NICU doula would be appropriate for them or they would benefit for one? But it doesn't really, it really sounds like you're saying, before I even asked that question, everybody would benefit from one. Is there ever a situation in where you're like, okay, this is like such a 4-hour NICU stay, like maybe somebody doesn't as much need one, right? Because it's like
potentially. And it really that's when I love the idea of having a NICU. So I have my ways of kind of differentiating the training. Like when you go through navigating the NICU for doulas, say, for example, you went through navigating the NICU for doulas, you are now NICU informed. So you would feel like you have the extra tools and resources to kind of step into that 4-hour window of time and be the buffer and the mitigator of the very real trauma that can still happen from 4 hours of separation and fear and unknown and the overwhelm. Sometimes even in NICU families will do this inadvertently, and this kind of either they minimize their own.
They're not enough. It wasn't enough of a big deal.
Only 4 hours. This person had 4 weeks, so I can't complain. We at least statement ourselves.
At least, oh man,
I had a good. At least we went home. At least blah blah blah. And then they're suppressing or not even really giving space, or maybe even the people that are loving them, like doulas and their families, are kind of inadvertently adding to fueling this feeling of you should be okay because it wasn't that bad. But then they're like, well, it still feels like my body is still feeling this feeling of like, this was really bad. And so I want every single person who's even like whiffed at the NICU to be able to have someone that can allow them to feel the very real feelings that they might have around that stay and recognize that impact on how that's going to maybe even feed into their next days and weeks and months together as a parent, because it does shift it. Even if it's not explicit, the subconscious shifting is usually there. And I've seen that manifest a lot of different ways. Sometimes the families that I work with post-NICU, a lot of times those super medically complex babies that are being discharged and they still have tubes and wires and meds, they're getting a different level of support post-discharge. Mm-hmm. They might have home health nursing. They're seeing in-house PT and OT. They're going to all these appointments, which is a whole nother piece of needing support. But the families that have those shorter stays, maybe they're like a 34-weeker that's in the NICU for a week or whatever it is, a cooling baby that was there for 7 days, they go home and are kind of stuffed in the normal healthcare model, and it doesn't fit right. Like, even if it's kind of working, the families always feel this feeling of isolation and confusion and overwhelm because they're trying to like almost like move on too quickly from something that was very real that happened to them and their baby too, because the babies also have bodies that are kind of, quote, keeping the score too. Mm-hmm. And one of the roles of the NICU doula at the bedside is any noxious or painful procedure that a baby might need. We try to help families balance that with something that's neuroprotective, attachment focused, really focused on kind of not negating, but like equalizing, balancing the things that are happening to NICU babies that are necessary and maybe don't feel great, or at a bare minimum are annoying, like, tape and tubes and being woken up when they don't really want to be woken up, positioned in funny ways, versus actual painful procedures that some babies are experiencing with this layer of support, which is both going to help the baby and also then help the family feel more empowered and able to impact their baby's outcomes.
It's funny because the things that you're saying about why even for a short stay, all these at least comments to themselves that it would still be beneficial to have a NICU doula. Some people would say, well, like, but wouldn't that just be therapy? Like, wouldn't I just need a therapist for that? And yes, therapists can help. But if we like simplify it in the realm of birth doula, which a lot of people already know about, if we're like, okay, well, when you go into your birth and maybe it ends in a C-section, but along the way you had the information that you understood why it was getting that way, and you didn't feel like everything was just being done to you. You felt like you were part of the decision-making process. There was informed consent, shared decision-making. And so afterward, you don't feel traumatized from it because you had the information along the way and you felt like there was somebody on your team that was really helping inform you the whole way and make sure that everything wasn't just being done to you. Like you were just like, oh, well, I have no say in anything. Similarly, and yes, therapy afterward can still help for why you ended up needing a C-section, but the therapy is not going to help that immediate time where we actually lower the rates of trauma when somebody had that when going through the process. So having a NICU doula, when you find out that your baby is going to be in the NICU or whatever, like even if it's last minute and you didn't know before, that can actually make it so that you have less long-term symptoms or experiences around it. You may not have PTSD from your NICU experience because you had somebody going along the way with you, helping you understand, helping you plan out your day, helping you understand that like, yes, we have to have touch times because my baby was born so early that actually we can't hold the baby yet because it's too much for their nervous system. Helping process those things in the moment, which a therapist isn't going to be able to do, but that real life in the moment care can make a huge impact on the level of trauma that a parent is experiencing afterward.
Exactly. And that is exactly the case. And my goal with this work is to do more clinical research that clearly shows this, because we know it, especially around the NICU and this role of a NICU doula. We know that with trauma, like a lot of the how trauma turns into PTSD is that feeling of powerlessness. And as you said, like not feeling like you had a say in what happened to you. And there's elements of the NICU that are always going to be challenging. There's always going to be this period of separation and fear of the unknown and of that, is my baby going to be okay? And even as a NICU nurse and doula, I can't say, yes, your baby's going to be fine. Like we know the answer. We know the answer to how the story ends. We don't. But we do know that in this moment, we can zoom in and be able to give you all that you and your family needs to be able to, as you said, get through this in a way that feels as good as it can, right? Like it feels like it wasn't happening to you. You were seeing this as a challenge that you're working through and overcoming and navigating and figuring out along the way. So then when you're out of the chapter, like I always say, the NICU is only the beginning. It's chapter 1 of your story. You can enter into chapter 2 with a lot more confidence, clarity, and support. So then it doesn't continue to snowball beyond that. Like we almost like can not necessarily put a bow on it, but have this feeling of looking back on it and being like, wow, that was really hard. We did it. Like we got through this and I felt supported throughout it.
Rather than
like I was drowning and people were trying to go up and people were pushing me back down and people were making decisions on my baby that I didn't agree with, or if only I'd known XYZ, or, I was so sleep deprived. I hadn't been asleep for 7 days, or all the things that are currently happening in the NICU state. The rate of readmission for NICU families is much more statistically higher than a non-NICU family because there's no physical postpartum care happening in the NICU too. So not only is trauma going to be this lack of autonomy, but in order to have good mental health outcomes, physical health and mental health are so deeply intertwined too. Like if you're in pain and you're not being cared for, you're not going to have a great mental health capacity in the moment. Right. So there's so tangled. And the more that we can untangle those pieces of it and truly support families, a parent that is in a better physical and mental state is going to then create a baby dyad and continue on those thousands of hours post-discharge and the bonding and the connection and the parenting and all the different multi-layers that continue onward in a much more confident way. So the ripple effects are just massive either way. Like this is like generational work. Like it's kind of like, we were like, whoa, like what are we doing?
Why have we not been doing this?
That's the power of doula work in general, from birth to postpartum to NICU and beyond. Yeah. It's that feeling of support.
Real quick, one thing that I think that maybe I missed at the beginning of this conversation, we probably should have said, a NICU doula is not like a birth doula or a postpartum doula in that they're with you for your entire NICU stay. This is like a point of contact throughout your experience. You have meetings with, you have texts with, you can have phone calls with, but they're not like in person with you all the time as your baby is in the NICU, right? Like I think that maybe we need
it depends. So it's really like as people are going through and becoming NICU doulas, it's unique in how you really want to structure your care and capacity for supporting families. So some NICU doulas work more as this like emotional practical support. Like I still work with families virtually. I don't do in-person work right now. I have in the past, but all of my support is virtual. I have some students that are graduating and they are going in the NICU with families. They are, whether or not they're there like the whole stay, they're getting families set up. They're making their pumping supplies. They're having everything ready to go. If they sometimes are like, okay, the family wants to go home and take a nap and they don't want to leave anybody without the baby, maybe they'll sit at the bedside and just be present. And they're not like doing hands-on care or skills of the baby at the bedside. Others, I have some that are doing like postpartum doula work, but not in the NICU. So like one of the biggest parts of the NICU stay, especially if the family can't stay overnight or has a longer stay, is they're going to be discharged and going home, whether they're staying in the baby's hospital room or going to Ronald McDonald House or going literally home. So some of the NICU doula grads are offering the emotional support, but then going in the family's home and doing like turn down service, basically. Like I'm washing your pump parts. I'm having this nutritional meal that's cooked and prepped. And I'm like having everything ready to go so that when you come home from the NICU, you're just home and you can recharge and regroup, and you're doing that emotional virtual support too. So there's a wide spectrum of...
That's what's so beautiful about it, I think.
It is. It's
just
so
like
cool.
With a birth doula, some do virtual, some do the birth, some come at a certain point, some at others. Same with postpartum. I really think that that's so beautiful.
Really cool. And then I have others that specialize in antepartum support. So they are going in on for those moms that are on bed rest or are knowing they're going to have a NICU stay or they're high risk, and they're doulaing them in that setting with the lens of NICU prep and NICU, all the feelings that come along with knowing that your baby's going to be in a NICU stay and having like optimizing their NICU experience before it even starts too, or partnering with MFM offices or fertility clinics because of the high rate of NICU admissions that's associated with IVF. So there's a lot of different ways that NICU doulas can serve families, but so it's different. That's what makes it very different than birth or postpartum, where you have a very clear time frame of support. It's full spectrum in a different way. And I do have some students that are going through NICU Doula Academy that are already birth doulas, or they're already postpartum doulas, or they are newborn care specialists, and they're meshing them both together. And then others are purely doing NICU doula work. And you can build it however, what your capacity is and your vision is for supporting families too. And so when NICU families are looking for NICU doulas, one of the things is kind of envisioning like what level of support are they missing and how can we integrate them in. So if you already have, family members that are there able to help you with the practical level of support, but no one in your NICU in your family knows anything about the NICU, you might want that emotional support, the spot checking, that like tangible care that is more of that like finite pockets of time, where others are like, there's nobody here. I need you to doula me through this whole stay. So everyone builds their packages differently, and their support and families can kind of find the best fit for them and their unique needs and their baby.
I love that so much. Well, can you tell people if they're interested in learning more about you, how they can find you? And I will also include that in the show notes.
Yeah, absolutely. So I'm on Instagram, probably too much. I'm at the NICU Translator. You can also go to at NICU Doula Academy too, if you want to learn more about the program. My website is the NICUtranslator.com. I have both on there, the Navigating the NICU for Doulas, which is the self-paced course, or NICU Doula Academy, which I host 3 live cohorts a year. So when they're not open, it's application-based. So when they're not open, you can just put yourself on the wait list so you can be notified as soon as it opens. And then I also on the website have a bunch of free resources. So you can download the birth plan template if that's something you want to. I just want that out in the world. So I make it a Canva link, like you can copy and paste and put it in if you're a parent listening, you're like, I should probably fill this out. You can do it. Or if you're a doula and you're like, I want to add this into my resources, have it, make it yours. And then I also have a podcast too called the NICU Translated Podcast, where I go into in depth on more specific topics around supporting NICU babies and their families.
I can totally see parents who went through this experience themselves wanting to become a NICU doula, even though they never thought they wanted to be. I would say about a third of my students are NICU families that don't have other types of doula training or support. The other third are doulas and newborn care specialists and nannies. And the other third are medical professionals who want to bring doula care and doula style support and trauma-informed care either to their clinical practice at the bedside or to transitioning into that role, like I did, post-clinical support in a non-medical framework with using your skills in a different way. So which makes those calls so valuable. And like the magic that I didn't realize was going to exist is we're bringing together all these people and their stories, learning from each other too. Exactly. That is everyone so cool. Has this actual full deeper understanding and can fill in the gaps of maybe what their experiences with the NICU or not, and really make it so that you can support families in this very unique and much needed way. Awesome. Thank you so much for being here. This was awesome. And I can't wait to continue learning from you. Well, thank you so much for having me. It was such a joy to be here. Thanks for listening. If you enjoyed today's episode, please take a moment to follow, rate, and review the podcast. It helps us reach more families who can benefit from this resource. For more resources, classes, and services, head to empoweredbeginningsatx.com or check out the Birth Baby Academy at birthbabyacademy.com. Until next time, wishing you confidence and calm on your journey through birth and beyond.